Hello, Medipreneurs. I am here with Mollie Scott, Associate Dean at UNC School of Pharmacy, who has a great session planned for you on Saturday afternoon at the Medipreneur Summit. You'll actually have two times to listen to her. So welcome, Mollie Scott.
Thank you, Michelle. It's a pleasure to be here with you today. And I'm really looking forward to the second Medipreneurs Conference. I was there last year and look forward to being there this year and being a presenter.
I'm so excited you're able to be there and present this year. Tell us a little bit about your history in clinical pharmacy and we'll just kind of set the stage for the great information you're going to share in your session.
Sure. So I have practiced in family medicine outpatient clinics for 22 years and have had the pleasure of starting ambulatory care services two places. First at Duke Family Medicine back in 1997. That was a long time ago. And then again at Mayheck Family Health Center in 2001. And over the years of ambulatory care practice, I've seen healthcare systems transform from systems that are fee-for-service based to more value-based care. Mm-hmm. And so also thinking a lot about population health and what types of patients could benefit from a pharmacist's services the most in primary care. And so I'll be talking a little bit about my journey, but probably more importantly, we'll be talking about how to get services started in an ambulatory care clinic that has never had them before, or also maybe they have some services, but they're ready to expand and think a little bit differently about how to extend access to comprehensive medication management services within a physician office.
There's so much need for that. As you know, we've got a shortage of primary care providers right now, and we know that pharmacists can greatly help with that. At Medipreneurs, we want to have valuable content for what we call intrapreneurs, which is people that are already in a practice. They have an employer, but they want to expand services, like you were just saying. And we also want to have content for entrepreneurs who see opportunities to go out and do their own consulting or develop their own clinical practice. And in the case of what you're speaking about, in collaboration with other healthcare providers. So tell us a little bit about how your session's going to work and why it benefits both groups.
Mm-hmm. Yeah, that's a great question. And, I think every time we have expanded services into a new clinic or we've thought about offering a new service, we always have to think about what's unique about that practice or that environment that we're working in. And thinking about the types of practitioners that you'll be working with, the types of services that are needed there, how we might develop a financially sustainable business model for the type of work that we want to do. And then we're always thinking about how we need to change to best meet the needs of the patients that are in that particular community. So I think that this session will be helpful for people who are starting from scratch, or maybe who are thinking about a population or a collaborator that they've never thought about before in terms of how do you freshen up what you're already doing and pick it up and replicate it and sustain it in an area that you haven't worked in before.
Mm-hmm. Wonderful. Well, I know with working with you since that 1997 practice you started at Duke, that you are amazing at connecting people and building relationships. And I'm sure that's been key to developing the practices you've developed. What kinds of tips might you be sharing in your workshop that are going to help people that are maybe a little bit nervous about that part?
Yeah, I do think relationships are really key as you are, setting up a new business or a new service. Those relationships are incredibly important. And so, part of my story has really centered around trying to find things in common with the people that I work with, particularly around vision and the goals that we're trying to achieve together. So part of what we'll be talking about is creating that shared vision and having an understanding of what the people that you're working with are working towards so that you can really connect with them and achieve the goals that the entire community has for improving patient care. And I remember a physician telling me many years ago, she said, I've always enjoyed working with pharmacists, but once I realized that Mollie really cares so deeply about the patients that are ours together, and that we're working towards the same goals of trying to help this patient achieve overall health, and that we can do that better as a team than we could do it individually. She said, that's when I knew I never wanted to have a practice without a pharmacist on my team again. And so that really speaks to the importance of relationships, and knowing the people that you're working with, knowing what you're working towards, and making sure that you are communicating the passion that you have for your work and the deep compassion that you have for that individual patient.
I know that the team members that you've considered part of your team has been quite broad. Can you just kind of quickly tell us what sorts of other health practitioners have been part of the teams that you've been most active in?
Yeah, I think everyone that's in the practice is on the team.
Mm-hmm.
No matter what your job is, everyone who's working in a practice is focused on, in some way, improving the health of their patients. So, obviously physicians come to mind, nurse practitioners, PAs, the nursing staff. We do a lot of work right now as well with nutritionists, as well as with behavioral therapists, behavioral medicine faculty. They are very, very important members of our team. Also, we do a lot of work with care managers. As we think about care managers behind the scenes who are managing populations, because they may bring people to us who need to see us, or we may reach out to them to find out if they have resources that we've recognized that a patient might need. But at the end of the day, the other people that are so important are the triage nurses who are on the phone, the front desk schedulers. Everyone who's there to make a practice run is on your team, because they may be the ones who are explaining to the patient what the pharmacist does in the clinic, that we may or may not be dispensing. There may or may not be a pharmacy, and explaining the concept of the embedded pharmacist model within the clinic. Also the folks in the lab, because we may be ordering labs, and so it's really important for the lab staff to understand our role and what we bring to the team. So basically that's everybody who's under the roof, that we're all partnering together to take care of those patients.
So if you're coming to Medipreneurs Summit, or you're thinking about it, and you've wanted to be part of a robust, active team that very much values what you do, you want to come and be in this session to hear what that feels like and how that can be attained. So Mollie, we want those people to come and join you and listen to what you have to say. Do you have any parting thoughts for people that maybe are still on the fence?
Yeah, I think another thing to think about is that you can be successful as a pharmacist embedded in a clinical practice that is a smaller team. We've had some success with our pharmacists in very small rural clinics as well, who maybe only have a physician and a little bit of front staff help, maybe a medical assistant or a nurse. It doesn't have to be a team that's an academic health center, bells and whistles, every team member under the sun that's there with you, all hands on deck. This can also be done in smaller practices. And so I look forward to meeting all of the folks who are coming to Medipreneurs, and whether you want to get new services started, expand what's already there, whether you want to do this in a larger practice or you're thinking of a smaller, more rural community. I really want to help you achieve those dreams of helping patients in ambulatory care settings optimize their medications.
That sounds great. Cannot wait to see you in a short time at the end of April at Medipreneurs Summit.
Terrific. I look forward to seeing you then, Michelle. Thanks for having me.
Thank you.